Hello, and welcome to hashtag Our Doc Talk. This is NorthBay Healthcare's way to reach out to the community and answer questions on important health issues. With us today is Dr. Seth Kaufman. He's the Chief Medical Officer here at NorthBay Healthcare, and we're just going to get right into this.
Hi everybody, Dr. Kaufman. Nice to meet
And
you.
just as a reminder, if you're tuning in and you have questions, this works like any other Facebook post. You can write a comment and we'll see it and be able to relay those questions along to the doctor. So let's just start first by talking about our facilities and their safety. How safe are our facilities?
Our facilities are very, very safe. We have put in a lot of safeguards to make sure that anyone who's coming here is safe from COVID, from other infections. That's obviously one of the most important things we can do at North Bay. We have things like very restrictive visitor policies, which is very challenging. Sometimes we want people to be able to see their loved ones, but we also want to keep everybody safe. So we have very restrictive visitor policies. Our visitors and patients wear masks. Our staff obviously have very strict rules, guidelines around mask wearing and hand hygiene and using our PPE. We have a lot of great prevention strategies that we do around here, and so it's very safe coming to North Bay.
And that's what I was going to ask you to talk through some of the steps we've taken.
Sure. So we unfortunately, as some of you may know, we were one of the first community transmission cases. We were the first community transmission case in the United States. I say that to you because we have very early experience with COVID. We've been preparing for surges, setting up the safety measures to keep everybody safe, and researching and setting up policies since February. So it's quite a long time in this pandemic. I say that because we do a lot of things around here to help manage the COVID crisis. One is we cohort our patients. So people who do have COVID are placed in one area of the hospital. It's a really important measure to keep people safe and to use our resources wisely. We constantly are monitoring our PPE. So that's our personal protective equipment. Those are the gowns and the masks and the gloves and the goggles and everything that one needs to be able to treat patients with very infectious and diseases like COVID, and we have ample supply of that. As I said before, we really are very careful letting people in and out of the organization. We have mask guidelines and requirements for certain groups, and of course we respect the standard prevention strategies, hand hygiene, as much physical distancing as we can, and those are just some of the measures we take.
Okay. I'm having a little trouble here with the camera, so just give me
Understood.
just 1 second here.
Go higher.
Sorry about that. Okay, folks. This is what we call technical difficulties. Hang on. Why is this not? Yeah, it might just be easier to hold it by hand. I'll just do that. Sorry about that. I need the question list.
The flashlight.
Okay, so moving along. What message do you have for someone who is maybe having signs and symptoms of a medical issue but is concerned about coming into our hospital or our urgent care centers?
Sure. So just to avoid being too redundant, I'll just say that, and I know all our systems out there, all healthcare communities feel the same way, that if people have emergencies, urgent needs, procedures that need to be done, any concerns at all, we are safe places to go. Of course, there's a lot of alternative ways to seek care. We're obviously major advocates of telehealth and virtual options, and North Bay has those options. But when it comes to emergencies and things that really need an urgent intervention, people should not stay at home with those. And that's one community member talking to another. This is not about North Bay or another system. It's really our big concern is that people are healthy, and we are very anxious as a healthcare community about people staying home with their urgent or possibly emergent symptoms. So, of course, there's the big ones that we always worry about: the heart issues, heart attacks, strokes, the big things. Some of those have pretty subtle symptoms. It's not. It's well known that you sit home with that chest pain, and I'm telling you, it's not. That's not a reason to stay home. Hospitals are safe. We've instituted a lot of measures, as I've just discussed, and you should seek out care, whether it's from us or from anyone.
Okay. Does North Bay have adequate PPE supply?
Yeah, so as I said earlier, we've been working on this, a little longer than others because we had experience both with our proximity to Travis Air Force Base and also because we were the first community transmission case here. So we've been monitoring and making efforts to make sure we have an ample supply of that personal protective equipment since the very beginning of the epidemic. And so we have ample supply. Doesn't mean, like all systems, we don't know what lies in the future, how many spikes or surges there will be. So we are, we have policies in place to be really good stewards of that PPE, and we are just constantly monitoring it very closely. So at this time, we have ample personal protective equipment, but are being very, very careful with that supply.
We have somebody who posted a question wondering, is a nebulizer effective if an asthmatic gets COVID?
Is a nebulizer effective if an asthmatic develops COVID? I'm not aware of any data that shows that nebulizer treatment doesn't treat the infection. I could see a situation where the COVID, because it's a respiratory illness, could trigger an asthma exacerbation, and then a nebulizer treatment would help in those situations. I'll also say on that note that nebulizer treatments and inhaler use have been shown to be at least equally efficacious. Actually, most studies show that inhalers actually are more effective. It doesn't always feel that way to patients. They see the mask with all the vapor coming out, and it feels like it works better. But actually, studies support that inhalers work better. I say that to you because we are trying to use more inhalers and less nebulizer treatments. It does in COVID patients because it doesn't spread the infection that way. So if you do need to seek care and you have COVID and you need a nebulizer treatment because it triggers your asthma, you might find that the doctor, the PA, the NP, the nurse, the person ordering and delivering the medication are going to be really trying to use inhalers exclusively for that, and you should give it a chance because honestly, it works better in most situations.
Okay. So what's the situation locally? What's the prevalence of this virus in Solano County?
Really good question. I get that. So overall right now, we have a very low prevalence of COVID compared to other counties. And actually, I'm going to read you some of the numbers. This is public information. Our Solano County Public Health dashboard is on the public health website. You can actually get a good amount of information. There's a lot, both on the dashboard, and you can learn a lot of information on the public health website. I think ours is better than many I've seen out there. As of yesterday, it's updated every day at 4:30. There were 397 confirmed cases, and we've tested almost 6,000, so 5,934 residents. I need to put a caveat in there that while testing's getting better, and I'm guessing we will be talking about testing on this during this session, that we don't have widespread enough testing of the entire community to say, well, that's what our prevalence is for sure. We're just not there yet. I think finding 400 cases out of almost 6,000 is very helpful. 6,000 is a good number, but we're a county of 450,000. So it's just not there yet. And remember, to really get a good prevalence study, you need to test everybody, right? It's not just testing people who have symptoms or not, and we're just able to start doing that a little now. So be very skeptical of the data you see. We are, our county partners are, and the goal would be more widespread testing.
Okay. And so there's concern that, as we start to open up again, we might see another surge. How prepared are we for a surge? Do we have enough equipment and PPE if there's a surge? Do we have enough ventilators if there's a surge?
At this time we do, so we have a good set of benchmarks and metrics and requests from our state through our county to make sure that we are prepared. That's both, we have hospital capacity, we have ventilators, and I think one of the most important pieces, do you have surge policies? And we have really good surge policies. We know what to do. If we suddenly get 10 patients, and then 20, and then 30, we have practiced a lot of this. We have set up kind of a green, yellow, red, street signal system to, warning system, so that we can slowly step up our surge resources, and we are prepared for a surge, and we practiced it. So many systems have set that up also, and we feel comfortable that we can handle a surge if it happens. I'll tell you, I'll put my plug in that I believe the shelter in place and a lot of the prevention transmission efforts, from hand hygiene to mask wearing to social distancing, one of the most important, to our quarantine and shelter in place orders, have had a really good effect on flattening that epidemic curve, and we should continue with that as we try to loosen our criteria, try to get our economy started again. A reminder that those really had the biggest impact, and if we all want to avoid ever having to activate our surge policies, the goal will be to continue with those efforts.
Okay. So if you have COVID and you need to go to the emergency room, do you need to call ahead, or what's the process for that?
That's a great question. If you have COVID, or you're concerned, if you have been confirmed to have COVID, you've been tested, or your symptoms really sound like it, go to the emergency room. Call your doctor for an appointment. Activate a virtual offering from urgent care, from your primary care doctor. Seek care in some way. There's nothing special you need to do. There's nothing wrong with telling the staff, if you are going to go into a clinic, to tell them that that's why you're coming. They will ask you when you make an appointment, and you can say, well, I'm worried about COVID. But we already have policies and steps in place to make sure that we're quickly getting you back. Placing a mask on you. You should have a mask already on when you enter, but if you need that, we have it, and then getting you to the right location so that we're protecting you and protecting others. So you should follow your normal rules, which for NorthBay would be calling in, which would get you a scheduler or vice nurse, and more often than not, if you're well enough, we will set up a virtual visit. And then if you need testing, we can set that up also. So go through the normal steps, and the emergency room is completely open to you if you feel sick enough and require it.
So how many tests are we doing at NorthBay, and how long does it take to get results, and how confident are you in these test results?
We have, at NorthBay, we have 3 locations where we are doing testing, right? Well, there's 3 types of locations, 3 types of locations. Our urgent care centers are doing testing for symptomatic people, so people with symptoms that possibly are COVID related, and so we will have both our Fairfield and our Vacaville location. That's also the way that we get our primary care patients tested. We do have some of our highest priority testing, which the state and our county have set up tiers, like here's who the group is that should be tested first. One of the highest in priority groups is our hospitalized patients. So we have a way to test them. And then in very limited situations, we also have some testing in the emergency rooms. There's not a lot of supply of quick tests that we can do in the emergency department, but that is available. We can do a good amount of testing on a daily basis. I don't have exact numbers for you because it just depends on the day and what's available and the capacity. But in general, we have a test that takes several days to come back, and that can either be sent through Quest. That's one of the 2 big commercial lab companies in our country. Quest is a big one, and that's who we use currently for some of our testing. And then our county partner, Solano County, also has testing capabilities. And both the county and Quest have continued to try to increase their capacity to handle more tests. Those take several days to come back. Some weeks, maybe they're 2 days, some weeks they're 4 days, and they just do their best to get those tests done as quickly as possible. There is availability, and it's in the news, of rapid tests. We do have some rapid tests, very, very limited supply, and used in very specific situations. I will say, going to the value of this test, Do I trust those tests? I'll say that in medicine, we don't trust any test. You always want to put a test in the context of a clinical picture. You know, there's a lot of science in medicine, but then it comes down to really piecing all the different things together and then making a decision on whether this person has that disease or doesn't have the disease, and then discussing treatment. That's the same situation here with COVID. Does it look like COVID? What's our pre-test probability? Before I order the test, I decide this person looks like COVID or doesn't look like COVID, and then that helps me trust or not trust the test. I say that because the test is far from perfect. We're seeing with data this week that the rapid test may even be less perfect. The reality is both still have value, but you have to know how common it is in your community, which we have some idea, and you have to, on that individual person, decide whether you really think they have it or they don't have it. As an example, if someone comes in with symptoms, whether it's the cough, the fever, they've lost their sense of taste or smell, these are common symptoms, and maybe they've had an exposure to somebody, maybe there's a confirmed case in their household, it doesn't matter. If the test is positive, great, we've confirmed they have it. If the test is negative, I'm still going to think they have it. So, as an example where the test doesn't help that much. So, these are not perfect tests, they're far from it. We'll continue to see more data around this. So we don't know, we don't trust the tests. We use them as one piece of the puzzle.
So is NorthBay testing for antibodies?
At this time, we have the only availability of tests from NorthBay for antibodies is through Quest. So Quest has an IgG serology test that our physicians can order if needed. I'll tell you, our position on this is very common to the position of many of the professional organizations out there around serology testing. The result is very, very, very difficult to interpret. And its best use right now is looking at possible prevalence in very specific populations in almost like a research study environment. This population, whether it's healthcare staff or some other environment where they possibly may be exposed, I think there is some value. I say that now, this pandemic changes so frequently. As more and more data comes out, we may see that serology antibody testing has more value and maybe is helpful. That could change. If we do this again next week, I might have a different opinion, and that's hard to hear. That usually is not the case, but studies are coming out so quickly. But at this time, I think it's very hard to know what to do with those results. And in most situations, testing for an individual patient has very little value, and absolutely 100% would not change management. If you have IgG antibodies, we wouldn't tell you you're immune and don't worry about it anymore. We would have a hard time, although I think the data is getting better on this, to tell you for sure that was a COVID exposure. Some tests are better than others on that, and I think even in the next few weeks we'll have better data showing that. If you're negative, if you don't have IgG, we for sure can't tell you for sure didn't have it. So it's just not known at this time. Therefore, sometimes the test would create more anxiety and concern and questions than actually solve anything.
Is it possible to have false positives and false negatives in your testing, and how prevalent is that? And how do you adjust for that?
Absolutely true. It depends on which test we're talking about, and all that is true. And it goes back to my earlier comment around you have to look at the whole clinical picture. Let's say as an example, a serology test absolutely can have false positives in the sense that if you test positive for IgG, it could be positive because of one of the other coronaviruses. Let's talk about the more common tests right now. The nasal swab, the PCR test for COVID, that's our main diagnostic tool to test for COVID infections. If we get a positive test, it's actually pretty specific. It's highly unlikely that's a false positive. And so we generally do trust the test. If you have a negative test, it's more, depending on what your pre-test probability is, we do have concern that there's more false negatives out there. In other words, you actually have COVID, but the test came out negative.
Okay. So, what have you learned about management of COVID patients that are provided, improved outcomes, that are providing improved, what have you learned?
What have we learned? What have we learned around, like in the course of this enlistment, I'm going to rephrase that question for myself to clarify. So what have we learned, I think, in terms of treatment and management so that we can make outcomes better? We've had very good outcomes at NorthBay Healthcare. I'll tell you that I think the biggest bucket is what treatments work and what don't. And we see that outside of these walls also. Remdesivir continues to show benefit. And we've had success here with that medication. Hydrochloroquine, for instance, is another treatment option, has had very controversial and mixed results. And we, although also have had benefit of that medication here in our patients, of course it's hard to know, especially in our size system, right, with the amount of patients we've taken care of, which is a lot for our system, but not as, because of the size of our system, it's not a lot of patients. Whether it's because they would have gotten better on their own already, or whether it's actually the medication that's helped. And so I think we've learned a lot about medications and what works and what doesn't work. I think that would be one of the major improvements.
You hear a lot about remdesivir. I think I said that right. Do we use that here, and what results?
We have. It's very hard to come by. I think the Gilead, which makes the medication, is doing their best to allocate the medication in areas, and we continue to make every effort to get them to have the medication on, supply that medication at NorthBay. But we have used it in the past.
Okay. Is it possible for somebody who tested positive for influenza A or B last fall to have actually had COVID-19?
That an influenza test does not check for COVID. But to answer your question, you absolutely could have had both. So it's really hard to know that answer without a COVID test. And of course, going back in time and having COVID on our differential diagnosis, on our list of concerns, and going through your different symptoms. So the answer is absolutely you could have had both. And there's even some case series showing people who had flu who also had COVID. But just know that the positive flu test that person might have had in fall wasn't because they really only had COVID. I'm not aware of any data showing that a flu test is positive when actually it's testing for COVID.
Okay. Are you seeing any characteristics of those experiencing severe and asymptomatic COVID other than age or pre-existing chronic conditions? In other words, is there a higher prevalence, say, for instance, in the African American community, or?
Yes, we are seeing so. We're seeing what every community is seeing. We're seeing absolutely a disproportionate number of infections in African American communities and others. Otherwise, it does. We are most. Our patients fall all over the map, but overall, our concern remains older populations, those that have immunocompromising illnesses, whether they have cancer or undergoing treatment. Our patients with diabetes, cardiovascular diseases is a risk factor. So we definitely fall into that standard set of concerns.
Okay. And have you seen children with inflammatory condition?
We have not seen children with inflammatory conditions. We've had positive tests for COVID. We have not seen this recent Kawasaki's like syndrome at NorthBay.
Okay. Is positioning of the patient, does that have anything to do with the care, the way we take care of them? In other words, turning them prone or that sort of thing?
Yeah. So prone treatment is a known therapy before COVID, and that has shown benefit. And we do that in patients who have the lung infections from COVID or from others. We absolutely do prone positioning and have shown benefit with that.
Okay. I read this also. Somebody's asking about the use of vitamin D affecting the severity. Is that something you've heard about?
I don't know data on vitamin D, so I wouldn't want to comment on that and give you wrong information. So I'm not aware of this. I will say talking with other groups this week, you can't beat the basics. So exercise is really important. And I see some very funny videos around in some ways, the hypocrisy of telling people to go exercise, but also telling them not to leave their house.
Yeah.
So it's hard, but you can't beat inflating your lungs. So remember that at any given time when you're breathing, a portion of your lung is deflated, maybe even a little collapse. That's not dangerous in normal situations. That's standard, and you can't beat the effect of really inflating your lungs, getting your blood circulating. So exercise, I'll just put a plug out there that exercise is really important.
So with the flu season coming, how are we preparing for a fall surge?
Yeah, so that is on everybody's mind around here. The big concern from our leaders and what we see is that as we slowly reopen our country, will there be a spike in fall, and will that align with a number of things? Will it align with a flu epidemic? Will it align with people who have been home with their illnesses and now, as things loosen up, will seek care? And again, it goes back to that comment earlier about hospitals are safe, clinics are safe. If you need something, if there's something that's been held off, please reach out. Revisit it with your doctor. If you need care at the emergency room, please come. If you need care at the urgent care, please reach out to them. The answer is that we are ready for we've been practicing with our surge policies and the way we cohort patients in one area of the hospital, and we're prepared for both a flu and a COVID outbreak if needed.
And do you have any concerns about schools reopening?
Yes, I have a lot of concerns about schools reopening, and I have a few kids myself, and would love schools to reopen if it could be safe. It's very challenging, and I know I'm not alone in that it's very challenging balancing work and the distance learning policies that are out there and plans that are out there. Yes, I think there's not enough known about how the kids transfer the illness through each other and to adults. So I have major concerns around schools reopening, but I also know that has to be balanced with the fact that we need to educate our children. We need parents to be able to go to work, and we have to find that balance. I think a methodical, similar to what we're doing with the reopening of our counties, period, from the state down, a methodical approach that takes into account what we know works: social distancing, hand hygiene, and all the other measures to keep ourselves safe. I think a mix of somehow trying to open schools carefully to allow that and to get the kids some on-site education will work. But I am as nervous as everybody else is about this, and just similar to I'm nervous about reopening businesses and things like that, but I know that we need to make efforts to try to reopen. At the same time, we got to try to keep everybody safe.
Does obesity in younger adults play a role in the severity of COVID?
I haven't read data on obesity. It does often complicate a lot of illnesses, so I guess I would say I wouldn't be surprised, but I have not seen data directly on obesity. We have seen a number. It's in the news. There's public data around age groups. There was some of this seen in the Santa Clara outbreak. There's definitely, we are seeing young adults who have very severe illness. Now, there's a lot of, I would say, still falls under preliminary data or theories around why that is, whether it's they are more likely not to be fully shelter in place and social distancing. Is it because of, there's some discussions around whether viral load is a major factor, so it's how much you're actually taking in that affects your severity of illness. So there's a lot of factors beyond age that goes into whether you get sick from this. Genes are maybe a factor out there, other illnesses. So, but it's not, we all know this because we're all reading the news titles. This is not an old person illness or an obesity illness. It is an illness that is really hitting all age groups. Obviously, our children are least, even though we're starting to see more cases of those of children. But we know we're seeing all age groups affected by this, and we're seeing young adults with severe illness. So everyone has to be careful.
Okay. Do you know if NorthBay is considering anything like drive-through vaccines for kids? They go back to school.
Drive-through vaccines. It's a great idea. We are looking at we're looking at any way we can to allow for live visits for something like a vaccine where you cannot do it from home. At the same time, trying to comply and reinforce the social distancing. So all options are being looked at.
And someone's asking, have you or any of your staff been infected and it traced back to working with COVID patients?
Yes.
The initial.
Yes. The answer is yes. We were the first community transmission case. So before we knew COVID existed in the U.S. In hospitals, we had healthcare transmission from a patient to several staff members who had close contact with the patient. Since then, we have not had any cases.
Okay. Do we have enough staff to manage a surge?
Yes, we have enough staff to manage a surge. Absolutely, we feel comfortable with that, and that's part of what we monitor closely with PPE and other indices.
How's the public status in terms of needing more education about viral loads that we can address?
Oh, that's a good question. I think our communities are, what I see is we have very educated communities. We're an intelligent group, but I think the more the better. So the more we can do, I think we all feel like we get fairly bombarded with education, right? There's no lack of attentiveness to COVID guidelines and education, but I think the more we can do, the better. And the more we can educate ourselves, the better. I think if there's a more specific question around there, whoever asked that question, I'm happy to answer it. The answer is the more we can do to educate, and right now, of course, the best way to do that is over digital, virtual ways to educate each other.
Okay. If someone wants to do something to help in this battle against COVID, what can they do?
Yeah, so there's a couple great things you can do, and one is going to be very obvious. Continue to contribute to the prevention of transmission. So hand hygiene, mask wearing, social distancing, obviously complying with our shelter-in-place orders, providing feedback to each other in a respectful way. It is a community effort to try to keep this infection at bay, keep that epidemic curve flat. There's more other things you can do. We need people to donate blood, so the blood banks are getting very, very low. Remember, when we're shelter in place, the first thing people think about is not going to donate blood, right? So we still need blood. So if you want to help, it feels good after doing it, because you feel like you've really contributed, go donate blood. And of course, all systems, including ourselves, have a foundation. We've really been so appreciative. There's been an amazing outpouring of donations, whether financial or other things. And you can absolutely reach out to NorthBay Foundation and help any way you can, and it will all go into the COVID effort.
Okay. Well, that's all the questions we have, and we just want to take another minute to thank you for doing this and let people know if you have other questions, you can always email them or post them, and we can get them to the doctor and try to get you an answer. You can follow us on Facebook. It's facebook.com/NorthBay Healthcare. And you can check out our website, northbay.org, and there's a COVID page there as well. Thank you so much.
Stay safe, everybody. Thank you.